At Virtue Dental Care, our focus is cosmetic and restorative dentistry, but what we really have a passion for is biologically safe dentistry and safe mercury removal. Mercury safe dentistry is removing the black fillings that most people have in the back of their mouth in the most safe way possible. By that being special suction equipment, ionizers in the room so that the patient nor my staff or myself absorb that mercury vapor. Several things about mercury fillings are dangerous. Number one, they crack teeth. That's an established fact. But we also know that mercury vapor comes off those fillings as long as they're in the mouth. When you brush, when you chew, when you clench, when you drink hot coffee, mercury vapor is released and it's absorbed into the body, primarily the liver, the heart, and the kidneys. To properly remove a mercury filling, what we do, we provide a vinyl dam, we provide outside oxygen for the patient, we have special vacuum equipment around the patient's face to remove that mercury vapor, ionizers in the room to remove mercury ions, we have special suction equipment in the basement to cleanse the wastewater that leaves our building from mercury. There's two major ways that we replace mercury filling, depending on the size of the filling. If it's a large filling, we're probably going to recommend an onlay, which is kind of a partial crown or a 3/4 crown. If it's a small filling, we're going to use a composite or tooth-colored restoration. Both of those are going to be tooth-colored when we're done. Well, one of the processes, if we do a porcelain onlay or crown, is we use the CEREC technology. That allows us, as the patient's here and while they're numb, to produce that onlay or crown in that single visit. It generally takes about an hour and a half from start to finish, but we're able to go ahead and cement the restoration while the patient's here. The advantage of the patient is one visit, one numbing, one time off of work, and no sensitive temporaries that sometimes come off. Well, the longevity of these new CEREC restorations is incredible because of the fit so good. But it's always dependent on how well the patient takes care of them. Someone who clenches or bruxes their teeth have already probably broken their own teeth, so the longevity would be a little less. We still have to floss and brush and eat the proper food. So these are long-lasting restorations, but it really depends on patient cooperation. For more information on either aesthetic dentistry or general dentistry or mercury safe dentistry, call us at Virtue Dental Care, 679-2034.